to Keeping You in the Family with Dr. Margaret Aranda on the Caw 360 Network.
Hi, this is Dr. Margaret Aranda. Good evening. It's so wonderful to have you here on Keeping You in the Family and Caw 360 Network. So pleased to have you here. There are two ways that you can listen to the show tonight. The first is on www.cawnation.com, or a YouTube channel is Keeping You in the Family. Just type that in the search bar. And you can chat with me live while we're filming here today. There's a chatter room right next to the video on YouTube that you can ask questions, and then we'll announce when we have a question. Also, you can call in as well to area code 415-403-2715. And then on the YouTube channel, if you could be so kind as to go ahead and subscribe to us, set up your account and subscribe, that would be amazing and great. And if you'd like to volunteer for Caw 360 Network, or if you have questions for me or for Dr. Klein or Claudia during their shows, please email them to Jonelle. She's at jonelle.elgaway@caw360.com. Tonight's topic, I'm very pleased to bring to you. It's a little bit complicated and thorough, but you know, that's what we always do. I'll give you the science first and make it practical as well. We're talking about anti-inflammatories, synthetic steroids, and regenerative medicine. We already did diet, sleep, sex, and sex hormones. Last week was bone, joint, and nerve stability. And also, next time coming up is topical and regional anesthesia. I'll spend some time on epidural steroid injections. And then we're talking about microglial cell inhibitors and last, pain medication. So go ahead and share your experiences with us if you've taken some of these supplements or medications or any of these regenerative procedures if you've had them. Again, call in tonight to studio line, area code 415-403-2715. And thank you guys very, very much. So this is a pretty comprehensive topic. Inflammation, we went over in the very first talk on diet. I spent about 15-20 minutes on that one. As you can see from the next slide, this inflammation covers everything from brain fog to the food you eat, hot, cold, infections, soreness, swelling, no sugar, turmeric, flare-ups, exercise, autoimmune disease, being swollen, and actually also being in pain, of course. And we're going to talk about really the top 6 supplements here. This says top 10. I was going to do 10, but I didn't really find other good ones. So the first one we're going to talk about is turmeric/curcumin. I think a lot of people know that this one is good as an anti-inflammatory. Resveratrol, alpha-lipoic acid, fish oil, or omega-3s, as well as ginger and spirulina. It's interesting on the next slide. You can see that we have that bright orange color. That curcumin is actually from the ginger root family. It grows as a beautiful flower that colors pink usually. The spice turmeric is not the same thing. Inside turmeric, however, there are many different kinds of curcuminoids. The bioactive one is curcumin, and we're going to talk about dosing and what you need to do to increase its bioavailability, but it is felt to be powerfully medicinal. It is a phytopolyphenol pigment that's also used for dye as well from the curcuma longa plant found in India and Asia. It has a lot of properties, anti-inflammation, antioxidant, and many uses we can see on the next slide. There are a lot of clinical studies actually that show this is not only good for pain, but for heart disease and stroke, indigestion, diarrhea, liver disease, cancer, Alzheimer's disease, because it increases brain-derived neurotrophic factor, where it's a nerve growth factor in the brain. My father died of Alzheimer's, and so I'm always keeping my eyes out for things that could help Alzheimer's, because so many people, I think, have a lot of worry and anxiety about getting Alzheimer's if your parent had it, and I'm certainly in that group that way. It's a long and insidious kind of disease. But it's also interesting that recently curcumin was found to be as effective as fluoxetine or Prozac for major depressive disorder. So that's a really interesting one there. It was even better than placebo. That was a really good trial. It also has some use in memory and anti-aging. And if you're going to go ahead and buy some of these, you can see that usually you should not buy it by itself. If your product has curcumin, say usually is about 500 milligrams per capsule, it's usually combined with biopurine or black pepper. And most of the studies on curcumin were on 1 gram, but you can't consume a gram of curcumin in food usually. So we go ahead and take capsules. So you have a powder form in a capsule. Formulations add black pepper that has a compound called purpurine in it. In 1998, Shoba et al. Were the ones that published the first paper showing that curcumin inhibits intestinal and liver glucuronidation. What does that mean? That means that if you're one of the patients that has cytochrome P450 enzymes in your liver that metabolize faster than everybody else, say, requiring you to have 5 or 8 times the usual dose of opioids or other medications, it's possible, at least theoretically, that you can take curcumin and it will slow it down. It slows down the metabolism of things that go through the liver. The largest human dose, and I think the highest recommended dose, is about 2 grams a day or 2,000 milligrams. And each capsule should also have purpurine in it, or I suppose you could go ahead and buy them separately. The reason why purpurine is so important is because curcumin does not absorb well from the gut, but when in combination with purpurine, you can increase its absorption by 2,000%, which is a pretty huge number. And most people have not really found any side effects at a max of about 2 grams. I know some people that have been taking more like 3 or 4 grams a day. I think you have to work your way up to that, and it's not a bad thing to do. So the next one we're going to talk about is resveratrol. And resveratrol is found in a lot of purple and dark red things. As we can see on the next slide, we have it found in grapes and grape seeds and grape skin, as well as apples and radishes, pomegranate, apricots, nuts, walnuts, peanuts. It's a polyphenol. It comes in 2 forms. It's a right-handed and a left-handed molecule, cis and trans. The trans one is the one that's more biologically active. It's in more than 70 plant species. It was first isolated in plants. And red wine and blueberries are also highly composed of resveratrol. It is a phytoalexin, which means it's also antibacterial and antiviral. The French paradox is this is exactly what we're talking about when we mention the French paradox. The French eat a lot of food that has heavy creams and more fat than we do, say, for a cooked meal. But the French drink a lot of red wine. So that red wine offsets the bad diet, so to speak, and more than makes up for it. So that's why some people say that I can drink all the wine I want because it's healthy for me, when actually you can eat grapes and have the same effect. So you don't want to like push that one too hard. It's also antioxidant. When a compound is antioxidant, that means that it neutralizes oxygen-free radical species that cause everything from stress damage to your heart and your brain, heart attack, strokes, those kinds of things. It's also anti-inflammatory. Therefore, almost anything that's anti-inflammatory is going to be anti-aging too when you're talking about these kinds of supplements. This one is felt to be neuroprotective and actually can lower blood sugars as well. There are a lot of uses that I listed on the next slide. It has been used a lot in chemotherapy and in cancer prevention. If you come from a high-risk family that has a lot of cancer in it, some studies show that this can make a difference. Pre-op, before surgery, and before radiation therapy, some oncologists are using this to actually shrink a tumor. And also post-operatively, it's given sometimes to decrease the chance of spread of that cancer or metastasis to a distant organ. It's also used together with some chemotherapies, especially ones that may cause heart damage, to improve the effects of chemotherapy. And it's also been useful for heart failure, high blood pressure, stroke, intracerebral hemorrhages, and the antibacterial property has been shown to exist with Staph aureus, which is a common skin infection that causes things like cellulitis. It's felt to be neuroprotective and helpful if you catch a rotavirus and end up with diarrhea. So that's also helpful. And here's a nice, cute little infogram here about some of the health benefits of resveratrol. In the capsule on the left, you can see there are studies showing that it's been helpful in Huntington's chorea, which is a kind of seizure, PCOS, which is polycystic ovarian syndrome. The reason why it's helpful also for ovary preservation is because the molecule is similar to estrogen. It's also been helpful in Alzheimer's and Parkinson's, as well as ALS or Lou Gehrig's disease, as well as alcohol-induced brain degeneration, fatigue, and loss of vigor. And then you can see a couple things added to what we already said, with sources being found in grapes and peanuts. It's also found in berries, cocoa, and dark chocolate. So if you like your dark chocolate, and you find it to be helpful, it's probably the resveratrol in it that is the main component. There are really no recommendations for dosing of resveratrol. The research doses that they used in animal studies are much higher than what a human would take. The human studies that did study it showed about 2,000 milligrams a day, so they were probably pushing the envelope a little bit. Most supplements have about 150 to 500 milligrams per day as a recommended dose. And if you have a sensitive stomach, you might see some indigestion at the higher doses. And then in the next slide, I went ahead and just did a summary slide because we're going to get onto another section after this. You can see the top 6 anti-inflammatory supplements there. And we have alpha-lipoic acid, fish oil, ginger, and spirulina coming up next. And this is a summary slide for you. It has a dose and some effects of each one. So we already spoke about curcumin. That was about 2,000 milligrams a day with about 50 milligrams of black pepper. Resveratrol It actually decreases the inflammatory markers that we saw on our very first talk on diet. The dose, 150 to 500 milligrams a day. And for people on a blood thinner, it may cause bruising, mild bruising, things like that. So that's a mild thing that I found that you could watch out for. Alpha lipoic acid is made in your body. It decreases interleukins and other inflammatory markers. Can lower your blood sugar also. So it's kind of good for people that have prediabetes or diabetes. The dose is about 300 to 600 milligrams a day. Fish oil, there are two types of acids in fish oil. Docosahexaenoic acid is DHA, and that's the one that really is felt to have this anti-inflammatory effect. It also decreases cytokine levels of inflammation, as well as interleukin 6 and tumor necrosis factor alpha, or TNF alpha. The dose of fish oil is anywhere from 1 to 1.5 grams. And that one too, if you're on a blood thinner, you need to watch for easy bruising. Ginger is something that is actually very helpful for a lot of reasons. It's anti-inflammatory, especially helpful with inflammatory bowel disease, kidney damage, diabetes, and breast cancer. It's also very good to have at the bedside if you wake up nauseated in the morning, or it's good to snack on maybe some ginger snaps if you have a migraine headache. The dose is 1 to 2 grams a day, or 1,000 to 2,000 milligrams a day. Spirulina, you probably know more as blue-green algae. This is very popular in a lot of circles. It decreases inflammation also. This one can boost your immunity as well and lead to healthy aging. It's great to take if you have diabetes as well. 8 grams a day is probably a good solid middle dose. And this one also decreases inflammatory markers. If you are immunocompromised in any way, it's probably not a good idea to eat algae though. So you might want to stay away from that one. And those are the best supplements that I could find. In the next section, we're going to quickly cover the over-the-counter pharmaceuticals and then go to some prescriptions and their different forms, and that's going to be the next section. So ibuprofens, Advil, Motrin, Naproxen, or naproxen, or Aleve is also anti-inflammatory. Aspirin, everybody knows Bayer. Icotrin, it has a coating on it, so it passes the stomach. So it could lead to less indigestion or abdominal pain. Also, it's thought to lead to fewer ulcers. Personally, I can't take aspirin that even has a coating on it because it still upsets my stomach. I don't know why. And ibuprofens, over the counter, is 200 milligrams per tablet. A lot of doctors prescribe 800 milligrams at a time of the exact same thing. It's just a bigger pill to swallow. So we're going to bypass these right away because it seems that most people have already tried and untried those. They have a lot of side effects. And actually, when I was a fellow at Stanford in the intensive care unit, I saw a lot of elderly patients coming in with an upper GI bleed. They were basically vomiting blood. And as an anesthesiologist, I had to try to intubate them with a breathing tube. And usually it was so bloody that I would just need to shoot for the air bubble that I saw because there were no other structures that were visible. We have a Kelly Lawyer. I have a question on that she asked about any particular grapes. Yes, it should be red grapes. And you want the ones with seeds, actually. So red grapes or purple grapes with seeds have a lot of resveratrol in them that are highly beneficial. And, a really fun thing to do with grapes at this time of the year in the summer when it's so hot out, rinse them out, take them off the vine, put them in a bag almost right away with a little bit of water still on them, and then pop them in the freezer. When they thaw, and then you're going to eat them frozen. They literally taste like popsicles, and they're very soothing, and each one lasts a long time. That's also a good snack to have if you get migraines or have any kind of indigestion or nausea where you can't really eat that much, so you want just basically something to suck on. So frozen grapes make a really fantastic snack. With respect to pharmaceuticals, I only prescribe a few of these. There are a lot of different kinds of anti-inflammatories out there. Diclofenac is popular in our clinic that sees a lot of spinal cord injury. I don't use very much Celecoxib or Celebrex. I don't use any piroxicam. I don't really use indomethacin either. I don't really use any of the ones on the left except for diclofenac and Celebrex. Rarely will I use naproxen, but I know that can be very beneficial and have less side effects. Naproxen is another derivation of that one too. Voltaren, Zorbilex, those are both diclofenacs also. Of all of these, the fourth from the bottom on the right is ketorolac tromethamine, or Toradol, and I do use a lot of that. Almost everybody gets a trial of ketorolac, and almost everybody gets the injectable form. Why? Because it's able to bypass the stomach and hopefully lead to fewer GI problems. And we can see on the next slide, I actually went to the ER not too long ago. And, oh yes, let's talk about this briefly. We have some combination pharmaceuticals that you may not know about. Naproxen comes with a couple of different things you can see here. And also you've got some caffeine and some like Furanef. That's popular with some people. Some of these are very old drugs, but they're combination pills to try to, help you have less side effects and more effect. But for me, for example, I cannot take anything that has a hint of aspirin in it because my stomach will just churn. So it's all very individual. We can, and I want to talk a little bit more about ketorolac. I hope it's on the next slide. Yes. So this you can see in the bottom right, there's a couple different formulations that ketorolac comes in. This is a non-steroidal anti-inflammatory in the same group with Advil and Motrin, or ibuprofen. It comes in 30 milligrams per ml. Another bottle has 60 milligrams per 2 mLs, which is the same thing. And the other one is 15 milligrams per ml. I just have people give a half an ml instead of going to the 15 milligram one because it's hard to find it. The 30 milligram is probably one of the more popular dosing. So when I went into the emergency room once with a lot of back spasm, I literally couldn't move my back. They gave me 30 milligrams of ketorolac. And I put the very first thing about this drug, especially if you've never had it in the past, is that it's extremely potent. I actually felt it in the first 5 minutes, but I'm not on a lot of drugs and I don't take things. I don't like taking medicine. So I'm a little bit of a lightweight, but I felt it almost right away. And for most people, it will last a good 8 hours. You have to be careful with this one for a couple of reasons. One is stomach upset. Ulcers in the stomach or small intestine are possible, so you never want to have this on an empty stomach. Also, in the very beginning, when ketorolac first came out around 1992 or so, there was a young girl who went in for elective knee surgery. They gave her, I believe it was 60 milligrams IV, and she ended up with failed kidneys and required a kidney transplantation. So that's how we all found out that this is not a good drug to take too much of because it's unforgiving. And also, I may prescribe this to almost everybody, but a lot of doctors never want to prescribe it for that very reason that I just mentioned, because they're worried about kidney failure or kidney insufficiency. This can be hard on your stomach, so I always prescribe it together with an antacid because the stomach pH, you want it to be alkaline and not acidic. For those who don't like the thought of an injectable, I think you're missing out because you're bypassing the gut and the liver and all of those enzymes, the cytochrome P450s, and it goes straight into your bloodstream. But if you insist that you want to try a tablet first, I'll let you try the 10 milligram tablet. It's a smaller dose. You would think most things taken by mouth are a higher dose than given sub-Q or IM, intramuscular or under the skin. But for this one, you just need a little bit. And some patients do really well on that. On these, I don't put people on this medication usually unless I get their blood labs back. I want to know two particular numbers. One is a BUN, or the blood urea nitrogen. The other one is the creatinine, as well as the ratio of one over the other. Want to make sure that if we see your kidneys starting to become dysfunctional, we can nab it by checking your blood every 3 to 4 months. I also tell patients that if you get dehydrated, you shouldn't take it. If your urine all of a sudden comes out really dark, like brown, then you have to worry that your kidneys might be failing, or you're extremely dehydrated, or there's something definitely going on, and you should not use it, or you should hold the dose. But this is a very popular one. It's actually my favorite. And it's actually, I've done my own informal poll in our clinic, and this is the favorite drug of all, including the opioids, including everything, ketorolac. And I can also tell you that I have almost never seen a patient come in to our clinic having already tried this one time before. So it's not the kind of medication that you can tell your doctor you want, but it is the kind of medication you can tell your doctor about and reassure them that it can damage the kidneys, and agree to take it together with something to prevent ulcers. Agree to get your BU and creatinine, your kidney function, tested every 3 to 4 months. You are never, ever, ever going to take a double dose, and you're never going to take it 2 days in a row, because you can knock off your kidneys if you do that. So I don't prescribe this one to people that I don't trust in all of these follow-ups and in all of these administrations of my orders. And I think that brings up a little subtle point. Every so often a patient will tell me, it worked so well, I started taking it every 3 hours instead of every 4 hours. Well, you're not supposed to do that. A doctor's orders are really kind of like military orders, and you can't just go around experimenting with it on your own and then tell us about it, because that makes me distrust you. And if I can't trust you in small things, then I can't trust you in big things. And I hope that makes sense to everybody, because I don't want anyone to have problems with their kidneys. And I can also tell you that probably in the 20 or 30 years that most patients have come to our clinic, no one's ever had this problem with kidney trouble due to ketorolac. Everybody takes it the right way. So far, so good. Then in the next section, we're going to talk a little bit about synthetic steroids. You'd be surprised to see how many patients come into our clinic having never tried a steroid for their pain, for their back pain. So some steroids mimic what your adrenal gland produces, a corticosteroid, betamethasone, cortisone, dexamethasone, hydrocortisone, methylprednisolone. Methylprednisolone is my favorite steroid in our clinic because it crosses the blood-brain barrier. It comes in a 4 milligram dose, which is a pretty low dose, and I can put patients on a trial of it and see if it's going to help them or not. I'll show you when it gets, when we come back on camera. I have a dose pack of methylprednisolone. That's a prescription pack. And you take it as instructed. It's 6 tablets on day 1, and then 5 the next day, then 4, then 3, then 2, then 1. So it's 6 days of steroid. being tapered off very slowly. It can shock your body to go on it and off a full dose, so you don't want to do that. And then if you have not tried methylprednisolone for your neck, back, or sacral spine pain, then what I do is put you on one of these dose packs. This is a commercial one right here. You can see how this first row is the first day. And actually, they tell you to take it like 3 or 4 different times during the day. I tell my patients to take all of them the first night, period. Number one, you should wake up the next morning feeling like you have no pain. It should make a big difference. And then the following days, you're going to take them with meals, gradually going down and tapering the dose down. So many patients in our clinic have never been on a medical dose pack, have never tried methylprednisolone, even one time. Their doctor never prescribed it. So I like to try it on everybody with an understanding that it's a trial. So you'll take it as directed and taper down off of it. And then I put enough, I write my own taper dose, so you get a bottle of about 30 of them in your first prescription when I prescribe it. And that way, if you felt that it was a benefit, then I'll let you take one of those tablets every Monday, Wednesday, Friday, of course with a meal and with an antacid, because that way your level of tone that's in your inflammation will go down a notch with the beginning 5 days, and then it will stay down by just pulsing it in every so often. The benefit of that is that you have 4 days a week with nothing, no steroid, and you'll see we're going to talk about the complications. Jessica has a comment for us. Which steroids caused my avascular necrosis? I've been getting cortisone for a torn rotator cuff and very rarely used prednisone for really bad pain. Yeah. So avascular necrosis of the head of the femur is a thing that happens as a complication of steroids, a long-term damage, pretty much, because the blood supply to where the leg bone connects to the hip bone becomes compromised, and basically the head of the femur, the bone starts to die. Now, there are some medications that we can give at the same time. One is pentoxabalin that increases blood supply to small areas, and we have a doctor in our practice who had a long history of steroids. She started to get avascular necrosis of the head of the femur, went on pentoxabalin. It took a few years, but the whole thing got reversed. So if we put you on the dose pack and it doesn't work, we never go back to it. We never put you back on it again. And if you say it helps, then we pulse it just Monday, Wednesday, Friday. And then a lot of patients have so much pain that they do have like a flare about once a month or every 6 to 8 weeks. So I give them enough. If you trip and fall, you cough, you sneeze, and you end up, really hurting your back from that, which a lot of patients can do, then go ahead and take one on Monday, Wednesday, Friday, and just try to keep the inflammation down, and go ahead and give yourself another dose pack once every 6 weeks or so, because it'll lighten the load of everything else you have to take. So we're protecting the stomach at the same time and putting you on medication to perfuse blood supply to your hip. So all of those things are things that we can do. The other thing is that let's talk just a second about a torn rotator cuff. You can see on the slide that we had up that a lot of doctors do injections into joint spaces, whether it's a tennis elbow, a shoulder, a finger, ankle, knees, Achilles tendon. A lot of doctors, behind the knees especially, inject triamcinolone or cortisone injections into joint spaces. Personally, I never do that. I won't do that because a lot of studies show that it actually damages the tissue. It doesn't really heal it. It's damaging to nerves, tendons, ligaments, and muscles, all of them. There's almost no way that you can not damage the tissue. So I'm not a big fan of this, and part of the reason is because there's something else that's better if you're going to inject a joint with something, and we're going to talk about that in the next section, so I'll leave that one out. Love it. Hi, love it. I know you were here for our first show. Thank you for being here again. She asks, are there foods that mimic prednisone? That's a really great question. Not that I know of. It's a synthetic it's a molecule that, that the adrenal gland produces. And I don't know of any food sources. So on the next slide, we can see a couple of things. Side effects. This is huge, right? If you've had an organ transplantation or you need to take steroids for the rest of your life because you got diabetes and you have a new kidney, you're going to get most of these. You're going to retain water and sodium. You're going to gain weight. Your legs are going to be swollen. Your blood pressure is going to be high. You're going to lose potassium, get headaches. Your muscles will become weak. And you have to try to, do what you can to mitigate that and try to, have it be less of a problem. You can grow facial hair, your skin. Steroid skin is pretty classic. It's very thin. It has very fine wrinkles on it. You can get infections, cataracts. Your wounds won't heal. If you need surgery, you might end up with a pneumonia and die from it. You can get glaucoma. Definitely, you can get stomach and duodenal ulcers. That is something that's extremely common. It also, every single time you take a steroid, it will make your blood sugar go up. So if you're diabetic, that you have to have much finer control during those times. It can definitely mess up your period and give you what's called a buffalo hump at the back of the neck, right above the bone that you can feel at the base at the neck, get like a humpback. And that's from steroids. It's funny because when I'm at the airport, I see all different bodies walking around everywhere, and my mind diagnoses people with things when they walk by. I can tell when people have been on steroids for a long time. You will develop what's called a round facies and a round trunk. You will never have a small waistline. You're going to be obese. That is just what they do, and there's nobody that gets by without that if you have to be on steroids every single day for something as important like a kidney transplantation. So even when you take the dose pack, the first night, taking the first 5 tablets, you won't have insomnia because it really won't work that fast. But starting the next morning when you wake up, you're going to be wide awake, and you're probably going to want to paint the walls in the middle of the night because you're going to have so much energy. At the same time, I personally do not like the way steroids make me feel. They make me feel very jittery and upset. I feel like they make me short-tempered and impatient, and I don't like that part of it. And that's the reason why I like to write my own prescriptions and not just give the Medrol dose pack, because I think the dose pack is too strong for most patients, especially if you've never had it before. One of the very most important things that can happen because of steroids is bone loss, which includes osteopenia and osteoporosis. And we went over those in our last talk last week. So yes, and then there's also avascular necrosis of the head of the femur. So you can need a total hip replacement from steroids. So, everything is a risk and benefit ratio. And I try to prescribe things that have more benefit than risk. But I also try to look ahead for the risks and complications and try to prevent them before they start. Then we're getting to our last section here is on regenerative medicine. I want you to know that it's something that I did not just make up. We know from chronic pain that we have a process of replacing our tissues when they're damaged. And sometimes that can't happen because it's not working for whatever reason. You've got a chronic injury, it's irreparable, and you have to suffer pretty much for the rest of your life with it the way it is. In California, we put you on palliative care and you're protected. But in the meantime, people are looking for something else. So regenerative medicine looks at the processes of replacing, engineering, or regenerating human cells or tissue for the purpose of restoring normal function. And you can see it's been used for lots of different things, a lot of different diseases, even baldness and facial skin tone. So on the next slide, there's a short summary for you here. I'm just going to take a sip of water real quick. Okay, the next slide. Thank you. Kobe Bryant and Tiger Woods, I think, were really, we have to credit them with doing regenerative medicine, stem cells, and PRP, and making it public. Kobe Bryant had a knee treatment, went to Germany for that. Tiger used PRP, blood therapy, everyday athletes. So on to the next slide. This is what I like to inject into the joints. The two things we're going to talk about here. Here's Stanford, UCLA, Harvard, University of Pennsylvania, Institutes for Regenerative Medicine. A lot of major universities, especially the ones with medical schools, have either a full MD section that's a stem cell institute or a regenerative medicine specialty, and some of them are even staffed by PhDs, not MDs, because they do so much research. So this is extremely mainstream. It's not rare anymore like it used to be, and almost everybody who deals with joint pain knows something about regenerative medicine. We'll go on to the next slide here. PRP, platelet-rich plasma. This is one of my favorite things. This is probably the most non-invasive joint injection that you can do that has the least amount of risk. There are over 30 active proteins that all help, say, a knee joint to heal. Normally, you can see the two figures at the top, the blue one and the yellow one. A normal blood will have mostly other things in it besides platelets. And then the one on the right side, all the blue is platelets. So we convert your normal blood and spin it down in a centrifuge. Then we have to take out a very thin section of it that has platelets in it and no red blood cells. And then we use that and re-inject it into you. So it's something that can really help recruit your own stem cells into the area. And we can do the next slide. How do platelets orchestrate healing? Well, way in the beginning when we did diet and we had that whole cascade of inflammatory markers, platelets are one of the very first things to arrive for any injury because you don't want your body to bleed. So when platelets are there, they gather everybody else there, and they bring in a lot of your own body's growth factors. Everything from platelet-derived growth factor, transforming growth factor, vascular endothelium. That's a blood, a vein or artery wall. You can actually increase the blood supply to an area this way. Epidermal growth factors, fibroblast growth factors, interleukins, colony-stimulating factors, and keratinocyte growth factors. Those are all just different kinds of cells that promote healing. And there's almost nothing else that you can get out of your body, your own body, that can look like this to you and get injected back into one of your joints to start your own body's healing process with minimal risk and no damage to the tissues. If I'm going to inject your knee, I'm going to inject it with PRP. I won't inject it with steroids. That's how much I believe in this. And then on the next slide, we can see it's a pretty straightforward procedure. It's been used for knee osteoarthritis, the kneecap, patellar tendinopathies, tendons, ligaments, muscles, the spine. It was first used after jaw and plastic surgery, and it's actually used also for wrinkles and facial rejuvenation, as well as hair restoration and baldness. It's been used in breast augmentation, dental procedures, OBGYN cases. It's quite extensive. The literature is just getting more and more dense as more and more people are studying it for different things. So this has been around for a while now, and a lot of us really feel that this is a great thing to do. We have a centrifuge and an extraction machine so that we can perform these in our office. If you were going to come in to get this done, first we would just take your blood, about 60 mLs, 50 to 60. It's a little bit. We would spin it down in a special centrifuge, and then put it in a third, the number 3 one on the right. We get it after it's centrifuged, it separates out into different layers, and we want the thinnest layer in the middle with no red blood cells in it. And we pull that out very, very carefully. It requires another machine to do that very specifically. And then we get that out and put it into a joint. Depending on where you live, the cost could be anywhere from $500 to $2,000. The pre-meds that you take before PRP, no NSAIDs, because they can inhibit stem cells from coming to the scene, and no NSAIDs after the injection for about 2 weeks. Insurance isn't so great at covering this. Most people have to pay cash, and it is possible to get 2 or 3 of these in a row. It does hurt to go in, and it may actually aggravate your knee for 2 to 3 months. And usually it takes about 3 months, about 12 full weeks, to have your knee be visibly and significantly better. Most of the time it's to the point where you won't even need surgery anymore. So there are some contraindications of PRP. You don't want it if you have a bleeding disorder, because we don't want to re-inject any bad blood or components that aren't platelets into the system there. So you can't be on a blood thinner. You can't have a blood cancer or an infection or a fever. You have to have a platelet count over 50,000 because we don't want to take them all away from you. So leukemias and lymphomas and Rocky Mountain spotted fevers, malaria, and other kinds of injections. If you're otherwise pretty healthy and don't have a lot going on with your blood, then it's pretty much good for you. And this is something that we're going to be doing too, PRP facials. We're going to be doing hair treatments and PRP facelifts. It's essentially what they're saying, because it stimulates hair growth. It can be injected under your eyes or around the eyes for crow's feet, the back of your hands if you need skin rejuvenation there, to decrease fine lines and wrinkles, get rid of acne scars, thinning hair. A lot of people on steroids have really thin hair, and hair loss. People lose clumps of hair sometimes, especially as they age and their sex hormones go down. So this has been very popular for quite a while, and there are just more and more applications of platelet-rich plasma, or PRP, that are always right around the corner. And I know this went really kind of quickly, but I'll wrap it up here with stem cells. Do they use stem cells for that? Yes, they do. We inject stem cells into joints. That's probably the number one use of them these days for the average doctor's office. You can do your own stem cells if you want to liposuction your fat, or get it from your bone marrow. Each of those is usually cash. Insurance won't cover it usually. And that's anywhere from $20,000 to $30,000, including the surgical fee, an operating room, an anesthesiologist. It's a big deal, and post-op pain, of course. I like to use a baby's umbilical cord from a delivery of a normal, healthy baby. The companies should be certified by the FDA and the American Association of Tissue Banks. They should be checked for all the viruses that are listed there. But this is probably the most highly anti-inflammatory injection or procedure that you can have in your body at one time. There are over 130 public cord blood banks around the world in 35 countries. It's regulated internationally by ethical standards and safety and quality measures that everybody agrees on. And umbilical cord cells have been going on for about the last 30 years, with over 30,000 patients using them. And it's actually been used to treat things like blood disorders and graft versus host disease when you're rejecting an organ. In pediatrics in particular, that's a big field. So a lot of times we like to use an ultrasound guided stem cell injection. I bring the product into the room, open the box in front of you. It's $3,000 to $5,000 usually, around there, depending on where you live. We pre-medicate with Benadryl and something for stomach acid, methylprednisolone steroid to decrease inflammation or some rejection kinds of things, quote unquote. There's no DNA transfer, only RNA transfer, and you're also not supposed to take any NSAIDs or Tylenol, but you can take Tylenol before this procedure. And you can see the picture on the right side there. When it gets injected, that's a lot of volume there. That looks like a big syringe to me. Really, with umbilical cord cells, we're only injecting 1 or 2 mLs in there. It's a very small volume, and it's clear. PRP should be that color too. It should be clear as well, because there shouldn't be any red blood cells in it. So this is where steroids get injected, PRP, and stem cells. And if you're going to get an injection into a joint, I think it should not be a steroid, period. And I want to thank you for being here with us tonight. And really, you know, it's wonderful for me to bring these things to you. Thank you for being with us on Keeping You in the Family, CAW 360 Network, for your daily dose of truth. I'm Dr. Margaret Aranda, and we're really pleased to have you here. Stay tuned with us every Wednesday at 8 p.m. Eastern Standard Time, as well as Sunday nights. We have Claudia on the Don't Punish Pain Rally, the talk show. Guest Mac Haddow will be her guest this Sunday, I think, at 6 p.m. He's the one who's a lobbyist for Kratom National. So also Tuesdays we have Dr. Klein, although this week coming up we're going to skip a show because of the 4th of July, so there won't be a show on Tuesday or Wednesday, but definitely keep us in your mind. Talk to us on Twitter, Facebook, LinkedIn. We're all over the place. And I want to thank Jonelle and Brian for producing the show today, and I'm always here for you if you need anything. God bless you all, and we'll talk to you again next week. I hope this has been helpful. Take care. Thank you.
Thanks for joining us for Keeping You in the Family. This program copyright 2019 by Dr. Margaret Aranda and CAW 360. All rights reserved.